today we are going to discuss about adrenaline auto-injectors. Right? Do you know what adrenaline auto-injector is? And when are we using it? We used it in anaphylaxis. I think I took a lecture about a couple of days ago on anaphylaxis. And I always say in anaphylaxis, the first line of treatment is adrenaline. Second line of treatment is second line of also adrenaline. Third line, fourth line, adrenaline. Fifth line, adrenaline. Until the patient recovers, we will be giving adrenaline. If the patient in the hospital setting does not recover after 2 shots of adrenaline, what do? You need to call for seniors. Get the seniors help because you need to get the infusion set up as soon as possible. Those are the ones with, we call them as refractory anaphylaxis. Those are the refractory patients. Those are the ones who will die. Anaphylaxis is not rare. It's quite common. But death from anaphylaxis is rare. Death happens if you don't manage it properly. You need to give adrenaline at the right time. Right dosage to the correct side. If you don't give them, you will kill the patient. So this child known to have food allergy, presents with abdominal pain, vomiting, urticaria after attending an arms giving. On examination, they were cold peripheries with hypotension. What is the diagnosis? It's obviously anaphylaxis. So, for anyone to diagnose anaphylaxis in clinical setting, any person with a skin condition, skin rash, presence with airways, breathing and circulatory involvement, it is anaphylaxis until proven otherwise. There are 3 different criteria, but in clinical settings, if you forget what the criteria are, remember that. Skin symptoms plus airways involvement is anaphylaxis until proven otherwise. But you need to remember about 20% of the cases, skin condition symptoms might not be present. So that's very, very important, especially in ward settings. So that's why sometimes we hear stories. After giving the IV injection, the patient suddenly collapsed and died. And that happened in one of the girls in Peradeniya Hospital. Where the girl admitted to a gastrointestinal infection. The girl was given Keftrax on IV, 1 dose. Patient had got anyway presented with diarrhea and vomiting. After giving injection, the patient wanted to vomit. Nurses let the girl walk to the bathroom. She collapsed and died. Because one of the hallmarks in anaphylaxis is hypotension, the blood pressure drops. When you stand, there will be sudden drop in blood pressure. That's why it's very important in managing anaphylaxis. You lie the person flat. Right? Position the patient is very, very important. Even after giving adrenaline, don't let the patient stand up. That can precipitate a sudden drop of blood pressure and aggravate influenza. So, adrenaline is usually available in ward settings. This is a very handy device called EpiPen. This is an adrenaline auto-injector called EpiPen. So, we have a program in our Institute of Allergy and Immunity where we give free EpiPens to every patient who needs to carry auto-injectors. Those are the ones who will run a risk of death due to allergic conditions. So we give them to administer. This is a self-administered device. Right? So, this is EpiPen. This is a self-administered device. So, when we teach our patient Because sometimes patients might come to you when you start practicing as a house officer, who has a GP, who has a family physician, they will come and show you, doctor, I got this device and I don't know how to use it. Can you explain? So you should know how to explain to your patient, right? So I have broke down different devices. So you can see at least two different colors boxes, right? So this is 150 microgram, 150 microgram, EpiPen JR. What is it? EpiPen Junior. So this is 300 microgram, the adult EpiPen. So that's why it's in two colors. When you meet a patient, you need to teach and train the patient on how to use this pen. So in the teaching, when you teach a patient, the most important thing is you need to tell when to use the EpiPen, when to use the adrenaline autoinjector. When do you use it? We can't tell the patient about the criteria, right? So we should be telling the patient. So if you think that you develop allergic reaction, because patient will anyway carry this device because they are already being diagnosed having anaphylaxis, past episode of anaphylaxis. That's why they carry this. So you need to tell the patient when you suspect of allergic reaction, whenever you feel dizzy, whenever you feel difficult in breathing, whenever you feel tightening of throat, when there is persistent abdominal pain and vomiting, that's when you use it. So that's the features of ABC involvement, right? So the very first educational message to a patient is when to use it. Second one is how to use it. So this has been designed for the patient. It's very easy to use. So when you have the device like that, you need to hold it. Hold it as if you are holding a motorbicycle. Right? You know how to hold the motorbicycle? You don't hold like that, right? It has to be with a nice fist. And blue, so there are two ends, blue end and the orange end. Blue is for sky. Blue is for sky, right? Always remember that because often patient forgets and hold it like that. So that is one of the commonest mistakes done by the patient. Not only patient, the doctors, nurses, and everyone will make the same mistake. So always remember that. Blue is for sky, orange is for time. Blue is for sky, orange is for time. So this is a very smart device. It won't work unless we ask it to work. How do you ask the device to work? You need to take the safety cap out. This is the safety pin. You have to take the safety cap out. And then, where did you give it? It's to the anterolateral thigh. Middle one third. So if you divide your thigh into three parts, it has to be middle one third and anterolateral. Right? You can give it to a clothes if you need to in an emergency. How do you give it? Emphasizing here again, hold it as if you are holding a motorbicycle. Blue is for sky, orange is for thigh. You keep it on the thigh, press it and hold it. Did you hear the click? Press it until you hear the click and hold it. Don't take it out. Hold it. Depending on the device. You can see here in this device, it says 03. I'm going to take it out. Don't inject it. Just take it. it says 03. So the latest device is 03. Those days we had 10-second devices, 5-second devices. This is a 3-second device, which means holding it for 3 seconds will be enough. But for the safety, you know, measures, we ask them to keep anyway for 10 seconds. Right? So then you take that pen out. You can see now. So it came like that. Now there is extension. Because there is about 2 to 3 centimeter needle, and this happens in the community setting. You don't need needle stick injuries. So that's why the needle gets automatically covered. Okay. So then you keep the pen away now. Now you have treated your patient. What do you do now? You ask the patient lie flat. Because once you stand, if you stand, the blood pressure might go. So don't stand very flat until you get help. You need to call the ambulance. Say that you had anaphylaxis. And you might get priority over the other calls if you say anaphylaxis. And you use the EpiPen. And I need to go to the hospital. So once injection is given, even though if you are completely fine, you still need to go to the hospital, right? There is a condition called biphasic reaction. A second episode can be triggered without an exposure within 4 hours. So that's why the patient needs to go to the hospital, gets him examined, and wait for about 4-6 hours until you are 100% clear that you will not develop a biphasic reaction. Usually 90% of the biphasic reaction occurs within 4 hours. Right? If it doesn't occur, it's very unlikely that those patients will not those patients will develop a biphasic reaction. So there are other instances. For example, patients with asthma, they runs a risk of needing multiple doses. Ideally, we ask patients to keep 2 devices, but unfortunately none is available in Sri Lanka. We are the only entity we give it for patients free of charge because we do have a program called Save a Life. Where we give all patients who are in need of adrenaline in the field, we give them free of charge. Okay? So you don't need to uncap or do anything because once it is used, it's a used device. You need to dispose correctly. Okay, so that's how we use. You need to tell the patient when to use it, how to use it, what to be done after using it. So those are the 3 key messages that you need to give the patient. Right? And after that, the patient needs to go and refill the EpiPen. You need to get a fresh one because this is a single-use device. Once it is used, you can't use it again. And that's it. Okay. Clear? Any questions? All good? So I will give you a chance to practice. Would you like to take the pens with needles? Okay. Demonstrate to me. Show it to me. Demonstrate it. Let the click and hold it. 4. I will be minimum 30 seconds, but please, ask to stay for about 10 seconds. And you can give a massage also if you want to. Right? And then lie flat and call the ambulance, inform the hospital, go to the hospital. Clear? So this is how to use administering auto injectors if you can ask. This is the only auto injector available in Sri Lanka. Would you like to try? because it is the only chance that you will use this one. So this is one of the mistakes that often our patients do. You don't inject when you are standing. So that's one of the commonest mistakes. They hold it to the other side. You have to sit and practice again. So don't worry about it. I said once you are used to it, you can't do that. So this one of the important things is you need to look at the expiry date. So these devices carry an expiry date, usually 1 year, right? So these are trainer devices. In the actual device, there is a window, right? So you need to check it time to time whether there is appearance of haziness, cloudiness in the device. So if there is particles, haziness, cloudiness, you need to discard the device. You cannot use it. The expiry date is clearly written here. So this device was expired in November 2022, right? So still this is an active device. That's why I always keep it in there. I don't want you to get it immediately with the expired date. Okay? Because this is one of the real things expired in March. But if you really want to understand how the device works, here. Now you can see can you see the needle? So this much of long needle. So this is a true device. I used it for the educational purposes for you because it expired. We brought it all the way from there for you to learn how the real device works. So you can see the needle. It's a large needle, right? And then once, unlike this device, you cannot pull it back. It's locked now. Okay? You saw the adrenaline going down. So that's why it's in children. It's usually in small children. Like the mother might be injecting it and touch you like that. So you need to hold the leg like this. Otherwise, the child will shake the leg. Okay? Hold the leg like that and then keep press and hold. For the children. For the children device. It's quite a large device. Needle. So always position the patient properly. Otherwise, the needle can damage the thumb. Right, that's about it.